For too long, we've had a health insurance system that crushes our hardworking families under the burden of the skyrocketing costs that they're seeing. And for too long, we've had a health insurance system that devastates small business owners and penalizes our best doctors and hospitals. Now, some of my Republican colleagues don't think this is an urgent problem. They don't think our country needs real reform. They tell us we should wait. They aim to do a lot of cheap political tricks just to delay us debating this and getting to reform.
If we allow this situation to stagger further, the problem only becomes more difficult and much harder to resolve. None of us want to see premiums double, as they will in the next 7 years, for $12,000 for a family of 4 to $24,000 if we do nothing. That's the status quo. 3.5 million jobs could be lost in our country. Bankruptcies increase, foreclosures of homes. The status quo is unacceptable.
The fact is that we understand that the American people need a fighting chance when it comes to these insurance companies. You know what happens. When you need that insurance the most, they turn you down. Pre-existing condition, caps on coverage, no, that your son's 24 years old, we're not going to cover him now. We address every single one of those in terms of fairness and equity.
For the first time, we're going to allow the American consumers to be involved in a buyer's market when it comes to insurance, not a seller's market here. The insurance industry decides what's going to happen. For the first time, we're going to say to seniors, you are going to get the kind of protections not only with Medicare, but also older Americans who haven't reached that magical age that I have, of 65, but still feel we'd like to have that kind of health care that you need.
It will ban insurance company abuses such as denying people for pre-existing conditions, dropping policyholders who get sick. It helps young people find better coverage, keeps them on their parents' plan until age 26. It includes a strong public option to give more competition out there. It helps families make more informed decisions on prevention and wellness. And that's something that hasn't gotten a lot of attention, but it's something I've worked very hard on. This bill has a huge thing in there to move us more for prevention and wellness, to keep people healthy in the first place and keep them out of the hospital.
What we do in the next few weeks will ensure that in the coming months, insurance companies will not be able to deny health care to people who are sick. It will ensure that in the coming years, families will not have to choose between their mortgages or their medicine. It will ensure that in the coming decades, we'll leave our children a better inheritance than a deep deficit and a broken health care system.
This is really a good bill, a really good bill, an outstanding bill. Who would have ever thought we could cover 94% of the people, save Medicare and private insurance, which were going broke, eliminate waste, fraud, and duplication, and at the same time cut more costs, unnecessary costs, from the federal budget, $503 billion, than any bill has ever done, and reduce the deficit by $127 billion. It's an incredible work.
It's all paid for. It covers all Americans, makes health care more affordable, reduces the deficit. Well, I guess as an old-line Democrat, here's what I got to say about that. We had the New Deal, we had the Fair Deal, and this is a good deal for the American people. Thank you.